Hi, my name is Mila Ali, and I'll be talking about the harms of animal testing. Animal testing has long been a controversial topic in the realm of scientific research and ethics. While it has been a standard practice for decades, the use of animals in experiments raises important ethical concerns and questions about the validity and reliability of its results. In recent years, there has been a growing movement calling for the abolition of animal testing in favor of more humane and effective research methods. My essay explores the negative impacts of animal testing on animals, the scientific limitations of using animal models, and the availability of alternative testing methods. It argues that the ethical and scientific shortcomings of animal testing warrant a shift towards more innovative and predictive research practices that prioritize animal welfare and improve research outcomes. The harms of animal testing include the suffering and cruelty inflicted upon animals, questionable scientific validity leading to misleading results, and the financial burden associated with conducting experiments. The use of multiple animal poisoning tests mandated by government regulations can result in significant animal suffering, inefficient use of resources, and scientific limitations. The high rate of failure of drugs and vaccines in human trials following successful animal testing also highlights the limitation of animal models in predicting human responses. The ethical implications and practical disadvantages of animal testing, including risks to human health, emphasize the need for alternative, more predictive methods in scientific research to enhance health and safety. First is animal welfare. Animal testing causes unnecessary suffering and cruelty to animals, infringing on their rights and well-being. This raises ethical concerns and questions the morality of using animals in scientific experiments. Animal welfare is a critical aspect to consider in the context of animal testing. The use of animals in experiments raises ethical concerns about the treatment and well-being of these animals. Animals subjected to testing may experience pain, suffering, and distress as a result of being used in experiments. It is important to prioritize the welfare of these animals and ensure that they are treated with compassion and respect throughout the testing process. By promoting ethical and responsible research practices that prioritize animal welfare, we can work towards minimizing harm to animals in research settings and ultimately contributing to more humane scientific advancements. Next is the scientific validity. The reliability and relevance of animal testing results to human health and safety are often questioned. As animal models do not always accurately predict human responses, this can lead to misleading conclusions and potential risks to human health. The scientific validity of animal testing has increasingly come into question due to the limitations of using animal models to predict human responses accurately. While animals may share some biological similarities with humans, there are significant differences in anatomy, sociology, genetics, and metabolism that can affect the outcomes of these experiments. This raises concern about the reliability and relevance of findings from animal studies in the context of human health and safety. As a result, there is a growing recognition that alternative testing methods such as organ on a chip technology, human cell-based assays, and computer modeling offer more promising